Welcome to UMeducates on Colorectal Cancer 101. The large intestine is found in your lower abdominal cavity. It consists of three parts: the colon, rectum, and anus. The colon absorbs the water and electrolytes from partially digested food and turns it to stool. The stool then moves to the rectum, where it is temporarily stored until it passes through the anus. Colorectal cancer may start when cells in the colon or rectum grow. These growths are called polyps. Over time, some of these polyps grow out of control and may even spread outside the colon or rectum. This is when the cancer happens. In 2020, colorectal cancer ranks as the second leading cause of all cancer deaths. Colorectal cancer might not cause symptoms right away, but if it does, it may present through the following: changes in bowel habits like diarrhea or constipation, feeling that the bowel does not empty completely, rectal bleeding or blood in the stool, abdominal pain, weakness or fatigue, and unintended weight loss. Factors that may increase your risk of getting colorectal cancer include diet rich in red meat and processed meats, being overweight or obese, smoking, alcohol use, type 2 diabetes, being 50 years or older, history of inflammatory bowel disease, family history of colorectal cancer, inherited gene mutations. Screening tests is one of the most powerful tools for preventing colorectal cancer. Stool-based tests check the feces for possible signs of cancer or polyp, but are needed to be done more often. Visual or structural exams look at the inside of the colon and rectum for any abnormal areas that might be cancer or polyp, the most common of which is colonoscopy. A colonoscopy is a procedure that examines the large intestine through a flexible tube with a video camera at the tip and passes through the anus, rectum, and colon. If necessary, polyps may also be removed through the scope. Let us discuss some myths and facts about colorectal cancer. Myth: colorectal cancer only happens to older people. Fact: colorectal cancer is more common in people over 50, but younger adults can get it. Recent studies show an increase in rates of colorectal cancer among middle-aged adults. Myth: you only need to get screened if you have a family history of colorectal cancer. Fact: anyone can get colorectal cancer. A family history just means you may need to start your screening earlier or have it more frequently. The American Cancer Society recommends that people at average risk should get screened for colorectal cancer starting at age 45. Myth: colonoscopy is painful. Fact: patients undergoing colonoscopy are sedated with anesthesia and are asleep during the procedure. It is painless and is usually done in 30 minutes. Myth: if a colorectal cancer screening shows polyps, that means cancer. Fact: not all polyps develop to cancerous tumors. If a polyp is removed during colonoscopy, it will still be analyzed in a lab to look for possible signs of cancer. Myth: you cannot prevent colorectal cancer. Fact: colorectal cancer is preventable in many cases through lifestyle modification. Here are some tips on how to prevent colorectal cancer. Limit your intake of red meat and processed meats. Eat more fruits, vegetables, whole grain, and fiber-rich foods. Maintain a healthy weight. Be more physically active. Avoid smoking. And drink in moderation. Colorectal Cancer Awareness Month is observed every March to highlight the importance of screening for the disease. Remember, prevention is better than cure. Talk to your physician about it. Like and share this video. For more of UMeducates, follow us on Facebook. Thanks for watching.